Hi, I'm Dr. Edythe Heus, and I'm going to share some of the settings that I use for cold laser. I've been doing a few videotapes so that you can see how I use cold laser, and I have settings that I've selected that I use frequently loaded onto the TheraLazr. So some of you have your TheraLazrs and you want to know how I use my settings, so that's what this video is for. So these settings are some that I learned from cold laser courses that I've taken, particularly featuring the Zirconia laser. Now the thing about Zirconia is that you can load 4 frequencies into the PL5000, which is the one that I have, but on the TheraLazr we're able to put more than 4 frequencies in. So we're going to start with arthritis. Now that's the first one in my presets, and I don't find arthritis to be that effective. I have much more success with the joint frequency and the muscle activation frequency when it comes to arthritic conditions, but it does impact some joint problems. I am experimenting with the infrared arthritis to see if that has greater benefits, and so far it's pretty equal, but I've been using red far longer than I have infrared. The next frequency is the asthma frequency. The asthma frequency is effective, and I hold it over the lungs, over the bronchioles, and then I also do the parasympathetic, sympathetic frequencies. Oh, also with the asthma, make sure that you use it on points on the back on either side of T2 through T5. All right, bacteria is one that I use diagnostically. That means that I'll hold it over different areas. Say I'm checking for bacteria in the lungs, and we're talking a need for bacterial therapy. And I use it diagnostically, and that using muscle testing. So I'll hold it over an area and see if a strong indicator muscle weakens, and then I'll also see if there are certain nutritional supplements that negate the strong indicator muscle weakness. But you can also use it and just treat it energetically. The Bone 36 is not something that I use a lot, but it's there to check for breaks, hairline fractures, bone spurs. Try it for arthritic conditions also. Bone repair, so that's a combination of about, I think, 8 or 9 frequencies that are applicable to the same things. Fractures, hairline fractures, stress fractures, chondromalacia. All right, and then brain is one of my favorites. I use it over different sections of the brain, different parts, the cortex, different parts of the cortices, the cerebellum, brainstem, or concussions, learning disabilities, and a lot of brain inflammation that arises from gut problems. Bronchitis is great in an acute state. Hold it over the bronchioles. Bruising, bruising that's associated with surgeries or trauma, definitely is effective. Burns, that's kind of obvious, just hold it over any burn. Carpal tunnel, this is another one where it's not that effective as a frequency, but it's effective enough to have it in here. Again, I tend to use joint and muscle activation for carpal tunnel and really investigate where it's coming from. A lot of it is fascially involved, or large intestine, liver, gallbladder. A lot of gut things will influence the carpal tunnel. So then you want to address those more directly using the gut frequency or the digestive frequency or liver frequency, which also helps with gallbladder. Circulation is very effective, very helpful when people have cuts on their fingertips, lack of circulation to their extremities. I find that helpful, as well as whenever anyone has sustained an injury or they have edema. Colds and flus, that's pretty self-explanatory, and you can hold it over the area of symptom as well as over the thymus, over the spleen, over the liver. Okay, concussions. I would use concussion and brain whenever there's a concussion. And you certainly want to get to that quickly. Okay, cramps, whether it's something like menstrual cramps, abdominal cramping, leg calf cramping, just try it. But also, if you have an idea of what the cause is, you want to treat that as well. Densities, I use Densities DX is diagnostic. So again, you take a strong indicator muscle, and if it goes into weakness with this frequency on an area of density, then it needs treatment. So then you switch to Densities TX, which stands for treatment or therapy, and hold it over the area of density. Usually it's important that you actually manipulate the density. Detox, I use that mostly diagnostically, and then figure out which area using a strong indicator muscle needs detoxification. And then say it's liver or kidneys, then I'll use the related frequencies of liver or kidney depending upon the area. Digestion I find really effective, and it can be anything associated with digestion, from anywhere on the esophagus, actually including the mouth, through the entire digestive system. So you can use it diagnostically and therapeutically. Emotional trauma is powerful, and it's important that you use the laser and these frequency over the area of involvement as well as on the medulla, which can be located either in front of the ear, and sometimes you find it showing up at the base of the occiput. So it's used whenever there's trauma that was so memorable the person is spinning their wheels thinking about it on an ongoing basis, or that you notice that an area that was traumatized or injured is not responding. Always consider the emotional trauma. Gut is oftentimes more powerful even than digestion, and so use it very much the way I describe digestion. Headache, that's kind of obvious, and hold it over the area of involvement. But also consider whether or not using the gut frequency or digestive frequency is important when it comes to treating a headache. Heart is another one of my favorites. Energetically, the heart regulates everything. So I oftentimes check heart with digestive problems, with injury or trauma. I check heart a lot. pretty much after I finish up with anything, I'll see if there is a heart factor involved. Herpes and shingles, that is used over the area of involvement, and you may have to hold it over there for, 4 minutes, 5 minutes. Immune, I check different areas that are tied in with the immune system. Could be the tonsils, the thymus gland, the spleen, liver, check kidneys, in women the uterus. Inflammation, I use inflammation locally, whether it's from an injury or from, allergies, gut inflammations, sinuses, many causes of inflammation. Injury would be something that I would use immediately and probably, until the injury is better. Frequently, on onset of injury, and actually that's the infrared. Probably you would want to use both the red and the infrared in any acute injury. Joints is one of my favorite frequencies, and I think I'll just quickly tell you a story. I had an ALS patient, and his arm was frozen because of an inability to use his arms, and it was when I first got my zirconia laser, and he couldn't lift his arm up, or even passively. When I would lift his arm up, it would freeze up and he would have soreness. And within 30 seconds of using the joint frequencies, he had full range of motion in his shoulders. So, and I use the joint and muscle activation on a regular basis to free up his joints. So the joints, the great thing about it is just putting the joint through a range of motion and using these frequencies will make changes in the joints and the mobility. It's also good for bursitis or tendinitis. The next one is kidney. Kidney, this really made a change on a patient of mine that was passing kidney stones. In the past, he has had 3 episodes of passing kidney stones before I was treating him, and his the passage was about 10 hours, 6 to 10 hours, as opposed to 3 to 6 days. So anytime you see edema, anytime there's kidney pain, anything related to the kidney benefits from this. Liver, very much the same thing. The liver helps with, my experience, improving liver function as well as gallbladder function. And I'll do it along with a liver gallbladder pump. Lymphatic is another one of my favorite frequencies. I actually use lymphatic and stroke along the pathways of the lymph system from the lower extremities up to the thoracic duct. Then I'll do the head, and I'll do the arms, all working to return the lymph to the thoracic duct under the left collarbone. So great for edema, great for overuse injuries, athletic injuries, and just generally when you don't have healthy circulation. Okay, muscle activation, definitely the one that I use more than any of them. And I use this because I am a kinesiologist. I do a lot of muscle testing as well as a lot of myofascial release. And the muscle activation makes the greatest change in muscle integrity, whether or not I have to activate the muscle locally, or if I activate it at the spinal level or at the cerebellar or cortical level. Okay. And muscle therapy, I find it more effective locally. So when there's an issue with a muscle that's not systemic, neurological, from some other source, muscle therapy is effective. The pain, the chronic pain is as described. For chronic pain, you hold it at the area of involvement, and you may have to hold it for up to 6 minutes. And then there's an acute pain frequency, arrangement of frequencies, so again for acute pain. Pancreas, like the other organ frequencies, I find it very helpful in regulating blood sugar issues and indigestion. Parasympathetic, sympathetic, I use it on strategic areas that relate to the parasympathetic and sympathetic nervous system, and that'll be the frenulum along the sternum, points in the mid-thoracic region, pretty much from T5 to T8, as well as just above the belly button itself and the tailbone. Parasites, I use it diagnostically, using a strong indicator muscle and seeing if the frequency of parasites over particular areas, organs, the gut, different quadrants on the abdomen, make a strong indicator muscle weak, then I'll run additional tests or supplement. Rash, skin, for any skin eruptions, itching, allergic reactions. Okay, scar sensory. So according to Jeff Spencer, Dr. Jeff Spencer, who does teach in association with Edythe Heus as an TheraLazr, he emphasized the importance of treating scars and explained that there's a sensory treatment as well as cross friction. So I use the scar sensory both diagnostically and therapeutically. So I do tug on the scar through the scar sensory, but the scar cross friction is when you really get in there and you work on the scar itself in different positions, different angles, so that you're going across and at a diagonal along the scar until you get a change in the texture of the scar, or a strong indicator muscle no longer goes weak on either the sensory or the cross friction. Sinusitis, self-explanatory over the sinuses. Surgery is a grouping of multiple frequencies laid out, so you hold it over the areas that they've had surgery. And you're going to have to spend a fair amount of time, probably 10 minutes, on areas that have had surgery. Tissue oxy is for tissue oxygenation. So any tissue that's been traumatized, you want to use tissue oxy on. Okay, trauma is very much like injury, but it works differently, and you just have to see which is most effective for you. And it's trauma that doesn't involve emotional trauma, but sometimes you have to use both emotional trauma and this trauma. Trigger point, so the trigger point is another frequency to use when you believe that you're working on a trigger point. Now, if the trigger point frequencies aren't working, then you can always try the density and muscle activation, and if it's close to a tendon or a ligament, again, try the joint frequency. Virus is used diagnostically and therapeutically, and yeast I use diagnostically to determine whether or not someone is showing up vibrationally with a yeast problem and where the location is. That's it for today. Thank you for joining me, and watch for this series of cold laser therapies that I'm putting up on this channel.